Good evening, ladies and gentlemen. This is Dr. Paul. Once again, thank you for visiting our website and listening to this video. Tonight I want to talk a few minutes about bipolar disorder, the mood stabilizing medications. You see, bipolar disorder is a very dangerous disorder, I should say, because some of these patients they hurt themselves. The suicide risk is very high, and they may also hurt their family members, friends, relatives, or even strangers, because the mania is it just shoots their nerves to a very highly excitable states. So bipolar disorder is something you need to remember all through your medical careers and know its treatment, especially as we are going to talk about mood stabilizing medications, especially lithium, valproic acid, carbamazepine, lamotrigine, and gabapentin. These are the mood stabilizing medications. Now, there are two types of bipolar disorder: bipolar type 1 and bipolar type 2. In bipolar type 1, patients have sustained mania and often experience depressive episodes, whereas in bipolar type 2, patients have one or more major depressive episodes with at least one hypomanic episode. So in type 2 we have hypomania. You see, bipolar type 2, that means depression and hypomania, that's type 2 is actually more prevalent than type 1, but most of the times we discuss the treatment focusing on type 1 disorder. Now, the treatment goes in three phases. Phase 1 is acute phase, phase 2 is continuation phase, and phase 3 is maintenance phase. In phase 1, that is acute phase, we try to establish the safety of the patient, because in acute phases patients are very suicidal, they are psychotic, they display poor judgment, and they also pose an imminent risk to themselves and people around them. So in the phase 1 acute phase we often hospitalize the patient. In continuation phase it may last from weeks to months, and the goal is to reach full remission of symptoms and restoration of functioning. In maintenance phase, that goes into years actually, and we try to sustain the remission. Now let us talk about the treatment for acute mania or hypomania. These patients pose tremendous risk to themselves. They can commit suicide, they can hurt others, so you need to always take safety measures first of all, even before you start the medications. Then the medications. Today let us talk about mood stabilizing drugs. The mood stabilizing drugs include lithium, carbamazepine, valproate, lamotrigine, and gabapentin. Lithium, first of all, the most important point you need to think about when you start mood stabilizing drugs is you should always think about coexisting medical illnesses. Lithium, for example, should not be started in a patient with severe renal disease or severe thyroid disease. And similarly, valproate should not be started in a patient with severe hepatic impairment. So those points are very important. Anticonvulsants may be more effective than lithium actually in patients with mixed mania or depression. Now let us go into the details. When you start lithium, you should start with 300 milligrams 2 or 3 times daily, with dose increases every 4 to 5 days. You can go up to 1200 milligrams per day for maintenance dose, and the target blood level is between 0.8 and 1.2 milliequivalents per liter. Lithium levels should be checked 12 hours after the last dose. And the other things we need to talk about is lithium has a very narrow therapeutic index. That means the levels you use to get the treatment and the levels you can get the toxic effects. That means toxic side effects is very less. That's why you should be careful with these patients. That's why you should check the blood levels with lithium so often. And this lithium is particularly has side effects on thyroid and kidney. That's why you should check BUN and creatinine to monitor the renal function, and the thyroid function studies to monitor the thyroid function. That's very important. You should do pregnancy test for menstruating women and electrocardiogram for patients over age 40. Now let us talk about the side effects. Lithium can cause polyuria because it can cause nephrogenic diabetes insipidus. It can cause tremors, it can cause loose stools, and it can cause cognitive side effects and weight gain. And tremors, how do you treat them? You can start a beta blocker. And long-term side effects of lithium include renal impairment, cardiac rhythm disturbances, and hypothyroidism. Now, whenever you start lithium, you should think about its interactions. When the patient is taking drugs like thiazide diuretics or non-steroidal anti-inflammatory drugs or ACE inhibitors, or potassium sparing diuretics, loop diuretics, calcium channel blockers, these drugs have tremendous impact upon the dose of lithium in the blood. That's why you should always check the side effect profile of these medications. Now let us talk about valproic acid. Valproic acid is first line agent that augments CNS GABA function, and it can cause sedation, tremor, ataxia, and GI distress, pancreatitis, thrombocytopenia, fatal hepatotoxicity, agranulocytosis. So valproate, it has equal efficacy with so many other mood stabilizing medications except olanzapine. Olanzapine has more efficacy than valproate, but olanzapine also comes with a price. It has more side effects than valproic acid. Valproic acid, we typically administer this medication twice daily, and the side effects, as I said, are weight gain, nausea, vomiting, hair loss, easy bruising, tremor, and you should always check hepatic function studies, that is the liver function studies, and platelet counts, because valproate can cause liver failure and thrombocytopenia. Now carbamazepine. Carbamazepine is actually a second line agent. It can cause nausea, skin rash, and leukopenia. The toxic reactions are AV block, respiratory depression, and coma. It can also cause, rarely, aplastic anemia and Stevens-Johnson syndrome. So that's a very important point. Carbamazepine has been associated with Stevens-Johnson syndrome and toxic epidermal necrolysis. Carbamazepine induces liver enzymes leading to frequent drug-drug interactions. So you should monitor carbamazepine blood level, liver function tests, complete blood count. Serum sodium is recommended at 6 to 12 month intervals. Now lamotrigine and gabapentin, they can be used for refractory, treatment refractory patients. Gabapentin is an adjunctive treatment only, and lamotrigine may cause ataxia, blurred vision, GI distress, and potentially life-threatening skin rash. So those are the main important points. Lamotrigine can cause some of the very life-threatening skin rashes in the patient, so you should always think about it. So mood stabilizing medications are lithium, valproic acid, carbamazepine, lamotrigine, and gabapentin. Let us talk about other things sometime else. So take some time to visit our website at www.usmlevideos.net. that is www.usmlevideos.net. This is Dr. Paul. Please send me your comments, and if I miss anything, please post it and send me your comments. Alright, have a good night.